Hi, welcome to Online Chats. I'm Diane Cohen, and today we're joined by Felicia Amenta. Felicia runs the school districts in Southern California, and she's going to share with us some of her programs that she has developed. So, Felicia, can you tell us a little bit more about who you work for and what you do?
Well, I'm the workers' comp program manager for the San Diego County and Imperial County schools, and I'm responsible for the workers' comp claims for about 63 member school districts and charter schools and a community college here in San Diego. I also manage the mental health counseling program that we have with Ease MHN, and I also manage our pre-placement physical and other medical services program as well.
Oh my goodness, you're quite busy. And amidst all of this that's going on, COVID-19, I understand that your organization has started a fast track program for COVID-19 claims. And I would love to discuss that a little further in this episode. But before we do, can you tell me what you and your organizations are doing to take steps to get your employees back to work?
So we don't have a date for reopening, obviously, our schools in San Diego County because our superintendents are working with Governor Newsom closely on that. But we're planning for reopening because there's so much that we need to do and so much that we need to consider to keep our 45,000 employed lives safe, as well as the children that we serve. That we sent out a short anonymous survey, and I thought I might share with you just a few of the questions. It was a very short survey out to all of our employees to see what concerns they had about returning to work. And we asked them what questions they had about returning to the workplace, what their main concerns were about coming back into the workplace, what suggestions they had about how we could keep them safe returning them to work, and what factors would help them feel more comfortable. And then we told them we were going to use their responses to inform our leadership team as we considered issues like continuing remote working, adjusting work hours, providing PPE to all of our employees, and implementing cleaning and distancing protocols.
Could you share with us what the biggest concerns were in the
Uh,
reply?
Yes, it was really interesting because the results showed some common concerns and needs that many of the employees had, and I'll distill this down. I would say the majority of the employees were concerned about us maintaining good sanitation and cleanliness at our school sites, to make sure that everyone was following protocol and guidance. They had concerns about us going back to the office too early and interacting with others. As for feeling comfortable to return, the majority of them said that they would feel more comfortable with proper sanitization available, masks available, cleaning supplies, that everyone was maintaining social distance and following protocols. And many of the employees, interestingly enough, responded that they had concerns and needs around childcare because schools are closed, so their kids aren't in school. And some of them are caring for others at home, and they had concerns about that. So that kind of gave us a framework of setting up a reopening committee, which is what we've done now, that's drafting plans to reopen. And then they're taking a look at those concerns from the survey about physical modifications to our school sites, policies and procedures, and purchasing that's necessary, because we need to buy some supplies and sanitization and equipment to get ready so that we are ready when the superintendent and the governors feel that it's safe to reopen our schools.
So what you're sharing with me right now are the same concerns for almost any business at all. So I think
Right.
the information that you're going to share with us on this program and what you're doing, I think it's going to be really beneficial to a lot of different people. So now let's say we've addressed all of those issues. We know what we're going to do. I understand that you've put together this fast track system for COVID-19 and kind of in collaboration with and because of your brokers and excess carriers. So can you share a little bit about that?
Yes. So in our workers' comp program, our policies renew every July 1 for our excess coverage. Both of the excess carriers, our coverage was bound and placed for July 1, actually before COVID even occurred. Our schools closed on March 16th before even the governor did the stay-at-home order on March 19th. We were already closed at all school sites here in San Diego County. And so in talking with our excess carriers and our broker, they were very concerned about special coding and asked what kind of special handling we were going to have for the COVID claims, especially in light of the governor's executive order that he put out on May 6th. They were really concerned that we were going to be taking this 30 days to make a decision on these claims and wanted sort of some kind of special solution. So in talking with our TPA and our dedicated claims unit, we took a look at all of our team and we chose some special individuals that have specialized skills that could, we chose a claims examiner, claims supervisor, a nurse case manager, one attorney from our panel, and we have 5 firms on our panel, and one investigation firm on our panel, which we have 4 investigation firms. So, and we chose all of these for very particular reasons because of speed and response and the short time frames that we have, because we're going to have to fast track these COVID claims. And our reinsurance carriers want them identified in a certain way. They want them reported every week in a certain way, and they want them coded in a certain way. So they can sort of, I know what they're trying to get an idea of what this exposure is going to be for them going forward, so they can plan also for the future.
Obviously, there are many very qualified examiners. So what would make one examiner better for your program than another?
So we looked at a few factors and we talked with the claims team. I work really closely with my dedicated claims team at Athens Administrators. And so we spent quite a bit of time talking about people that had a lot of experience, people that could work very quickly and respond very quickly. And we talked a lot about sensitivity and maybe some counseling or psychology background that some of these people had that gave them some special skills in order to deal with some of these issues. And we also chose people that had time available. Response time obviously was very important. Being thorough and careful is important, but these COVID claims have to be fast tracked because 30 days is no time at all in the claims world to try to gather all of the information that we need to make a decision if the claim is going to be presumed compensable, whereas we normally have 90 days and we struggle to meet that time frame. So that's why we really looked at time management and organizational skills and communication skills and empathy and a lot of those soft skills we took a look at.
Yeah, you mentioned the 30 days. I know that in the document retrieval business, 90 days, we were always doing our clients a great favor because we're able to give records very timely and they had plenty of time to review their records. But at half that time or a third of that time, they don't have the luxury of doing that. So hopefully everybody's going to, really do all the important ordering from any service provider out there from the get-go and hopes to get them in that 30 days.
Well, and we feel very fortunate too because we have a lot of, as you and I talked about, heroes. We have a lot of frontline essential workers that a lot of people might not know that while we've been closed down, we have our entire nutrition services department and all of that staff in PPE out feeding our needy families and children that we normally serve at school. And because school is closed, we were concerned about them getting enough food. And so we've served over 2 million meals in San Diego County to needy families. So they, like I told you, they inspire me to work every day because they're putting themselves at risk to do what they do.
Well, I want to thank you so much for sharing your program with us, sharing the good story with us. We all need a bright side, and to hear about how many meals that you guys have served is really very inspiring. And I hope that everyone reaches out to their fellow man one way or another as safely as possible so that we can help out. Thank you so much, Felicia.
Oh, you're welcome. It was my pleasure.